This information is for educational purposes only. It is not intended to substitute for professional medical advice and should not be interpreted to contain treatment recommendations.
Hello, my name is Sarah Bornby. I am a certified wound ostomy continence nurse and clinical consultant with Coloplast. This module will include how to use a 2-piece flex barrier with drainable pouch. I'm going to start with the barrier itself. I have a flat barrier here. Keep in mind, all of the turquoise or blue color indicates an action item. So this is our landing zone for our pouch. On the back side, you have the circular guidance here whenever we are going to cut the barrier out. And also, this is where you will pull the tab off to stick to the patient. The pouch itself has a circular filter. This is what we call a pre-filter. This helps filter out the thicker particles in the output so that the charcoal filter will not get clogged up as easily. We also have the drainable option here. I'm going to demonstrate how to open and close this particular pouch. Remember that turquoise or blue is an action item. So whenever we are closing the pouch, we always want our pouch to be closing towards the patient. So you have these 2 dark gray circles that will go towards the patient. So 1, 2, 3, Velcro, closure. And then we can tuck this in to make it a bit shorter. Now when we're opening it, to drain it, we're going to open this here like so. 1, 2, 3. Whenever you are emptying the pouch, you want to go ahead and fold this tab over. It velcros to the back side, and then you pinch the edges for easier emptying. Clean the inside with toilet paper. Make sure that you clean this tab and fold this over prior to closing it completely. This helps with any sort of odor or leakage issues. Make sure those 2 circular dots are again going towards the patient. 1, 2, 3, Velcro closure. So I do want to demonstrate how to measure and cut this barrier and apply this particular pouching system. We want to start with measuring our stoma with a measuring guide. You want to get as close to the stoma as possible. You do not want any skin showing. So we're going to find the right size here. We're at 38 millimeters. So I'm going to take that and I'm going to trace onto the barrier. I'm going to cut the barrier out with my curved scissors. It's very helpful to turn the barrier as you are cutting to help make a nice smooth edge so that the edges do not dig into the stoma and cause issues, such as bleeding. Okay, so after we make the initial cut, we want to make sure this is a right fit, and this is a very good fit. So before I apply the pouch, I'm going to demonstrate how to apply the pouch to the barrier first, and then we can go ahead and put it onto the teaching model here. So making sure that this landing zone here is nice and clean and dry prior to application of the pouch itself. If this is wet in any way, this pouch will not stick properly. So blue tab is a action item. Peeling off the back here. We're going to line up the edge of this to the blue line and apply like so. Okay. Now what's great about this pouch is that in case you need to redo that part, you can pull it right off and try again. Okay. Now with a 2-piece system, you can apply the pouch to the barrier and then onto the patient, or you can apply the barrier first and then the pouch. This is specifically helpful for patients to change their pouch on their own so that they can see when they have a 2-piece barrier. Now prior to application, be sure that the skin is nice and clean and dry before you put the barrier on. We're going to peel the barrier backing off. Nice and clean, dry skin. We're going to apply. Now make sure you have a good seal around the stoma first, and then you're going to work your way out. Okay. And now we're going to apply our pouch. Remember that the edge, the bottom edge, is going to line up with the blue circle in the bottom. So as it line up, go ahead and apply. And you just want to go around to make sure you have a good seal, nice and flat with no wrinkles or creases. And then you're going to be holding in place for a couple of minutes to maintain a better seal. This will activate the adhesive with the heat of your hands so that the barrier has a nice, good seal.
Thank you for taking the time to view this module. For additional ostomy education, visit us at coloplast.us.